Good morning. I'm truly humbled to be here today on behalf of Elizabeth Glaser Pediatric AIDS Foundation as we celebrate the 20th anniversary of PEPFAR, the program that saves lives of millions of children, youth, families around the world, including my own, like Nelson just said. 7 years ago, PEPFAR and the Elizabeth Glaser Pediatric Foundation and the fight for an AIDS-free generation were the furthest thing on my mind. After I tested positive for HIV when I was 17, close to 18, I was really surprised by the lack of support I got from the facility. I remember clearly what the doctor said when I was there to get staged, because when after you test, you go to the doctor to stage which WHO stage you're at, and she was like, "You see, you girls, you don't get to use condoms, and you'll definitely die of AIDS." So it was really painful for me, because really in my country, Lesotho, HIV is still a leading cause of death. So after I tested positive, I felt so ashamed and alone, believing that my dreams of having my family won't be there at all. But while the negative feelings I felt about my HIV status in that moment nearly defeated me, I was connected to PEPFAR-funded experts at EGPAF, who made sure that I was enrolled into treatment and connected with other young women like myself who were navigating the world as someone living with HIV. The support I experienced lifted me out of my depression. I was really depressed that I even attempted suicide. I was encouraged to know that many of the HIV-positive women I met there were able to stay in good health and have the babies of their own who are HIV-free. Over time, because of the medical and psychosocial support I received, I was able to achieve a viral suppression. So now I'm low and undetectable. And finally, my dreams of motherhood came true because I have a HIV-negative daughter who is 2 years old. So I know my story is not the unique one, because PEPFAR, over 5.5 million cases of new pediatric AIDS infections have been averted, and more than 20 million people have received life-changing care since the program is founded 20 years ago. So now that my dreams of motherhood have been realized, I work to give back to the young women in Lesotho who are impacted by HIV and AIDS. And as a senior youth ambassador for EGPAF, I help empower the adults and girls like I was accessing the HIV services and develop life skills to stay healthy and strong. In each interaction with these girls and young women, I emphasize that it is important of knowing one's HIV status and take strides to remove the shame and stigma associated with HIV. And for those who tested HIV positive, I provide the psychosocial support by connecting them to the peer support groups, which I was part of them, and really helped. And we establish strong bonds and true friendships, and we eliminate the feelings of stigma and shame, because most of the time our young people, stigma that we get, most of it is perceived, is the self-stigma that we have. We think that everyone still that we are HIV positive. So I share my story to say that having HIV does not define me, nor does it end my dreams for a prosperous future. Both my daughter and I, that achieving an end to a pediatric AIDS is possible if we prioritize financial and political investment in programs like PEPFAR. As I close, I want to acknowledge the tireless leadership of Secretary Blinkling, Dr. Nkengesong, and Dr. Fauci, as the global health community continues to strike and end AIDS and HIV in more than 50 other countries around the world. Thank you so much for inviting me today, and it's my pleasure to be here. Thank you.